She walked into my office and said 7 words I'll never forget. "I really don't recognize myself anymore, doctor." 46 years old, on 3 different medications, weekly therapy, still waking up at 3:17 a.m. with her heart pounding, at the same time emotionally numb, with decreased sex drive and weight gain, all side effects of her medications. In the next few minutes, I'll show you what her nervous system was actually doing, why her treatments failed, and the exact reason this is fixable. I'm Dr. Air, quadruple board certified psychiatrist. I've treated thousands of people struggling with anxiety. And before I explain a single thing about her brain, I want you to hear this. You're not broken, you're not weak, you're not lazy. If you have tried medications, therapy, breathing apps, supplements, and you still feel stuck at 3 a.m., the problem is not you. Your nervous system is doing exactly what it was designed to do. It just forgot how to turn off. Let's call the woman in question Maria. Her story is what's happening to millions of adults right now, and very few people are getting the right explanations. In 1915, a Harvard scientist named Walter Cannon was watching cats in his lab. When a cat saw a barking dog, its heart raced, its digestion stopped, its pupils widened. He coined the term fight or flight. What he saw in those cats is what your body does at 3 a.m. when nothing is wrong, but everything feels wrong. But here's the part most doctors never explain. Your nervous system was not designed to stay there. In the 1930s, a researcher named Hans Selye injected rats with various chemicals to study illness. Every rat got sick, even the ones injected with harmless saline. He could not figure out why until he realized something. It wasn't the chemicals making the rat sick. It was the handling, the cumulative stress of being picked up over and over. That's you. The term for this is allostatic load. It is the wear and tear of carrying too much for too long. The emails, the bad sleep, the aging parent, the teenager, the job, the blood sugar crash at 3 p.m., the scroll before bed. Year after year, your nervous system gets handled, and eventually it stops bouncing back. This is what we call a dysregulated nervous system. Maria had been carrying it for 9 years before she ever sat in my office. But this is the obvious part. The reason most people stay stuck for years is not just due to stress alone. So this next piece is where it gets strange. Most doctors look at someone like Maria and they say anxiety, they prescribe, they refer to therapy, they wait. I do something different first. I check the body. Here's what we found in Maria's labs. Her thyroid hormones were off, what we call subclinical hyperthyroidism. Her ferritin, a marker of iron storage, was very low. Her progesterone, the hormone that calms the brain through GABA receptors, had dropped sharply, and her blood sugar was unstable. Insulin resistance. She didn't just have an anxiety problem, she had a biology problem that was showing up as anxiety. When your thyroid hormones are deranged, it can cause your heart to race and make you feel panicky. When your iron is low, your brain cannot carry enough oxygen and your alarm system fires. When your blood sugar crashes, your body dumps cortisol and adrenaline to pull it back up. Those are stress hormones. This could feel exactly like a panic attack because chemically, they're similar. This is the part that surprises my patients the most. Before we blame your mind, we have to rule out your body. But there's a third piece, and this is one you may not have related to your anxiety. Inside your gut, there is a chemical factory. About 90% of your serotonin, the molecule we call the happiness chemical, is not made in your brain. It is made in your gut. I'll say that again. About 90% of your serotonin is made in your gut. There is also a nerve called the vagus nerve. It is the longest nerve in your body and it runs in 2 directions. Most people assume the brain talks to the gut. It does, but the gut talks back and probably louder. When the bacteria in your gut are out of sync from sugar, alcohol, ultra-processed food, chronic stress, or antibiotics, they send the stress signals up the vagus nerve to your brain. The brain reads those signals as danger, and it lights up the same alarm circuits as a real physical threat. You cannot calm a brain that is getting fire alarm signals from below. This is what we call the gut-brain axis, and it is the missing piece in most anxiety treatments. So Maria didn't need another medication. She needed protein at breakfast to steady her blood sugar. She needed iron and progesterone support. She needed to stop the wine that was fragmenting her deep sleep. And she needed to feed the bacteria that were sending up the stress signals. And here's what I want you to understand, because this is the part that gives me hope every single time. In the 1980s, a Harvard researcher named Herbert Benton traveled to the Himalayas to study Tibetan monks. In freezing temperatures, these monks could raise their own body temperature using nothing but breath and focus. Wet sheets placed on their bodies steam dry. Western science had said the nervous system was involuntary. The monks proved it was not. Your nervous system is trainable, not with willpower, with repetition. Slow breathing, morning light, steady meals, consistent sleep. Each one is a tiny safety signal. One does almost nothing, but 20 signals a day over 6 weeks retrain the system. And speaking of sleep, this is where I have to pause. Sleep is the foundation for everything I just told you. If you're not sleeping, your nervous system cannot reset. I put together a free sleep and nervous system guide that walks you through the exact protocol I give my patients. It is in the description below. Now, it is important to point this out. For some of you, anxiety and nervous system dysregulation won't fully resolve without medication, and that is okay. Medication is a tool, not a failure. I prescribe this every day. And if you've been struggling for years, recovery may be slower than you'd like. But slower is not the same as impossible. It just means we're undoing more years of load. Here's what I want you to walk away with. You're not just anxious. You're someone with a highly responsive nervous system that has been running in protection mode for too long. That is not a personality. That is not a diagnosis. That is a state. And states can change. Maria walked into my office and said she didn't recognize herself anymore. 6 months later, she showed up with a photo from a beach and a different sentence this time around. I recognize myself again. If you want to learn more about how Maria got back to her old self, check out the Nervous System Reset program in the description below.